Patient journey. So we get this all the time. Patients will ask us what it entails to have an assessment, what their options are going to be, even before they've even had an assessment. So I'm just going to go through a few of the steps to put your mind at ease when you're booking an assessment. So you can book an assessment via self-referral. So you can just go online and onto our website and contact us, or you can go onto our booking system and book the assessment on there. What we would advise you to do though, first of all, if you haven't already done so, would be to do the self-assessment online. Now this is free of charge, so you can go on there and try it out anyway, regardless, and there's no obligation to actually book an assessment at the end of this. Once you've done that, the system will prompt you at the end, depending on the outcome, to either book an assessment with us, or it will advise you to seek help elsewhere. At this point then, when it prompts you to do that, you can either book the assessment or you can contact us and we will then tell you the next steps. So what are the next steps? The next steps are normally that we need to book that assessment in, but before that we gather evidence from you. So we will need various pieces of evidence. Try not to worry when I say this, because we will guide you all the way through this and tell you what we need. And it's normally for a child secondary evidence we're asking, so this can be from a school, an after school club, a grandparent, because sometimes it can behave differently with grandparents than they do with parents. And if you're an adult, it can be a parent if possible. If not a parent, then a childhood friend, somebody who's known you before the age of 12. Other than that, we can go off school reports, anything that you may have that kind of indicates or some sort of evidence, as I've said before the age of 12. We also do a QB check. Now I'll go into a little bit more detail in another video about what a QB check is, but it's an online assessment. It's not a test. There is a QB test, but we're going to be doing the QB check, which for a child is about 15 minutes long and for an adult is 20 minutes long. Now this is done online. You're sent a link, and at this point you just go through the steps that the link follows you through, and the results are sent to your clinician to review, and it just guides and helps a clinician again when they're formulating a diagnosis or a non-diagnosis at the end of your assessment. You will then have your assessment. So your assessment, as I've said before, is done via video link. What this means is you are sent a link beforehand. We will check that you've got some form of technology to do the camera video link, and we will then obviously do the assessment, and at the end, if the outcome is that you have ADHD, then we will go through options after, which is treatment options. This could be in the form of medication, or it could be in the form of ADHD coaching, extra support, anything that you require afterwards, we can offer. If the outcome is that you do not have ADHD, we will advise you at this point on what the next steps are for you. So please don't worry. Again, we will guide and help you in any way that we can. You'll get a full comprehensive report. Now normally this is around about a week later. When you get this report, it will be also sent to your GP as well. A copy will be sent to your GP. So that's for you then to decide what, you know, if everything is satisfactory. If you've not chosen to have a treatment at that point, you can book a follow-up appointment as well to discuss treatment options. If you've chosen not to go for treatment right at the end of your assessment and you want to delay it a little bit and have a think about it, that's perfectly fine. If you require extra support in the form of more forms for something that you're possibly filling out or you're trying to claim for, then we can support with that. But normally most people find that the report is satisfactory enough because it'll have the QB results. It will also, your secondary evidence is compiled into that as well, and it will contain your diagnosis, and it will also contain the plan moving forward. So if it is that you've started titration, which I'll go into in another video, for medication, then that will be in part of the plan. So you can submit that as well if you need to. Thank you.